broadcast is brought to you as a joint initiative between Anubhav, the National Institute of Social Defense, Ministry of Social Justice and Empowerment, and Media for Community Foundation. Producers, CovaiCare Retirement Communities. If you are a senior citizen and need help, contact our Elder Helpline 14567 between 8 a.m. and 8 p.m. We promise to help you lead a better life. I repeat, 14567 between 8 a.m. and 8 p.m.
Namaskar, Vanakkam and greetings from Koivani. We have with us Dr. Saras Bhaskar, who is a counseling psychologist skilled in identifying psychopathology and offers necessary therapeutic guidance. As a private practitioner, she extends individual, family, pre-marriage, marriage, and family counseling. Her niche area is health psychology, focusing on the biopsychosocial framework, emphasizing the psychological well-being of people. She incorporates traditional and contemporary therapeutic techniques in her counseling interventions. Over to Dr. Saras Bhaskar.
Vanakkam. Proceeding from the golden years to platinum age and beyond can be a time-testing period for some of us. Brothers and sisters, this is Saras Bhaskar, counseling psychologist. I am now 67 years and feel genuinely pleased to share with you some knowledge and experiential learning to the best of my abilities. What are some causes of loneliness leading to depression? And I have listed some. Bereaving the loss of loved ones, changes in the family relationship dynamics. The third one is martyr syndrome. Fourth, mulling over the past. Fifth, lack of psychological hygiene. Sixth, age-related ailments or unexpected diagnosis or disease. When we speak about bereaving the loss of the loved one, it can be very devastating. Someone who we cared, who cared for us, who loved us, who spent their valuable time with us is no longer with us. The reality is, as much as we celebrate birth, the demise needs also be taken into consideration as a part of life. Instead of bereaving the loss, can we celebrate the life we had with them? The changes in the family relationship dynamics, you all will agree, the concept of marriage, family, the relationship in the family system has gone through a major paradigm shift. Nuclear families have mushroomed all over. Blended families are there. So what we did as a family member when we were growing up or in our younger days, if we had felt that we have sacrificed, compromised for the family to be intact, yes, there is truth to it. However, expecting members to acknowledge, appreciate, and continue that gratitude is something that would be our expectations, which would not be met. So, can we get over the martyr syndrome? Mulling over the past is going to only retain the negative emotions, which can turn into toxins in our body. And that leads to the lack of psychological hygiene, which we will be addressing a little later. There are theories on aging like biological clock theory, wear and tear theory that are being analyzed. On one side, we have certain segment of seniors saying that one must act according to their age and must learn to slow down their mind to balance it to the bodily changes or vice versa. Some others say that age is only a number. We come across visual and print media about senior citizens doing marathons and participating in competitive sports. How are they able to do it? If you ask them, they will share about their self-care and self-discipline. Besides that, they also exhibit their inner spark to be useful and productive. It showcases either in the form of altruism or being a mentor, role model for the family and friends. We cannot expect every elderly to consider being altruistic. That depends upon each of our interests and abilities. So, to combat loneliness. Tip number 1: please introspect on what your skills and interests are to be useful and productive. Number 2, self care. What do I mean by that? Every now and then, when I hear statements such as, I do not want to be dependent on anyone, or I want to be independent, I find those statements rather innocent or ignorant. Honestly, we are consistently dependent on somebody or something at all points of life, be it a milkman or domestic help. To me, we need to remember the subtle variation between the independence and self reliance. Self care can be a full time job, and believe me, it can and it will beat loneliness. You may say that it would work for the ones who are mobile. Well, for the ones who are not agile, if they can honestly take an inventory of how they can be productive and useful, I'm sure they will come up with ways and means. I can quote an example from my very own life. My maternal grandmother turned blind due to aging. Limited mobility did not deter her from helping us with household chores, especially whenever she stayed with me. She would fold clothes, polish silverware, remove roots from kirai, or cut vegetables that does not involve her viewing whether it is has little putti or not. And I can say many more that are within her capacity and competency. She has made herself productive and useful. And I could see the pride in her for feeling that way. So, when there is a will, there is a way. Self care is not about swallowing pills and not changing the lifestyle. I know some friends and relatives who manipulate medicines for indulgence. By self care, I mean self discipline. So, are we connecting mind and body here? Absolutely. Psychological well being is about connecting the triangulation of our thoughts, feelings, and actions. In other words, we professionals refer them to cognition, emotion, and behaviors. So, physical and psychological well being is about self care. That leads to tip number 3: psychological hygiene. We take bath every day, clean out our homes, sweep and mop, and remove the dirt and debris. Do we, in similar fashion, remove the clutters from our head and heart? Most of the time, we hold on to them so dearly, more so to negative life experiences. This can be toxic, and as mentioned earlier about the mind and the body connection, escalate into physical ailments, ending up in pain and suffering. Hence, building both physical and psychological immunity is self care. In this lifespan perspectives, the elderly has moved past the duties and obligations that we all have donned on the roles. It may not be to our fullest satisfaction or abilities that we could have performed our duties. In case of guilt or not doing sufficient at our best at that time, can we give ourselves a second chance to correct it in the form of words and deeds now? This will certainly diffuse guilt. Purging negative experiences, thoughts, and emotions, letting go of it would detoxify and help us from bad mouthing, bickering, and complaining, which can lead to loneliness because people who listen to all the above will find us unfriendly and toxic and want to move away from us. Then why won't we feel lonely? So, what we think, what we say, and how we say determines if we will end up being lonely. At this time, I would encourage ones who are unable to come to terms with grief, guilt, to seek professional help. There are trained professional geriatric counselors who offer necessary therapeutic guidance to spend the remaining of our life with peace and harmony. Thank you.
Thank you, Dr. Saras, for your interesting talk and on how one can cope with loneliness and depression. Thanking you once again on behalf of Koivani, and signing off is Revati Bhaskar.
இந்த வலையொலி அனுபவ் தேசிய சமூக பாதுகாப்பு நிறுவனம் சமூக நீதி மற்றும் அதிகாரமளித்தல் அமைச்சகம் மற்றும் மீடியா ஃபார் கம்யூனிட்டி ஃபவுண்டேஷன் இவர்களின் கூட்டு முயற்சியாக உங்களிடம் கொண்டு வரப்பட்டது. திட்ட ஒருங்கிணைப்பாளர்கள் டாக்டர் ஆர் ஸ்ரீதர் மற்றும் ஆலோக் வர்மா அவர்கள். வானொலி ஒருங்கிணைப்பாளர்கள் பூஜா முராடா, கௌசல்யா மற்றும் சாய் சுதா அவர்கள். தயாரிப்பாளர்கள் கோவை வாணி, CovaiCare ரிட்டையர்மெண்ட் கம்யூனிட்டிஸ். நீங்கள் ஒரு மூத்த குடிமகனாக இருந்து உதவி தேவைப்பட்டால் எங்கள் எல்டர்லைன் ஹெல்ப் லைனை தொலைபேசி எண் 145667 இல் தொடர்பு கொள்ளவும். காலை 8 மணி முதல் இரவு 8 மணி வரை. ஒரு சிறந்த வாழ்க்கையை வாழ உங்களுக்கு உதவி செய்ய நாங்கள் உறுதி அளிக்கிறோம். மறுபடியும் கேளுங்கள். தொலைபேசி எண் 145667 காலை 8 மணி முதல் இரவு 8 மணி வரை.
That's all for today, folks. Be safe. Fight COVID with 2 vaccinations. Wear a mask when you go out. Keep safe distance. Observe proper hygiene. We must win. We will win. Thank you.